Hello, Dr. James Bogash, expert in health and longevity, and while I've made it no secret that I'm not a big fan of the GLP-1 receptor agonists like Wegovy, semaglutide, Mounjaro, tirzepatide, that whole class, all starting with Byetta several years ago and moving through that, there's potentially some good for them, but there are some very important things that need to be done before someone goes on there. And this particular review is going to point out that almost no one who is going on these drugs is going through this assessment. But before we go through this, make sure you like this video, share it with somebody you think needs information, and subscribe to the channel. So, that being said, this was a kind of a think tank put together by the American College of Lifestyle Medicine, the American Society for Nutrition, the Obesity Medicine Group, and the Obesity Society. So these four groups came up with 5 things that need to be done before somebody starts on this class of drugs. Now, if you're on these and you did a telemedicine visit, think about if even a single one of these were checkboxed. And I'm guessing the answer is no. I've had patients with as bad of experience as somebody who put on weight with these drugs, but got it from a telemed pharmacy, and there was nobody to ask why she was putting on weight, which is a big concern, by the way. So, just really nobody to answer and to look at questions. So the first one is to set up goals on weight and health. So if you're using this to lose weight, at what point do we stop? Which is a whole nother question all again. But we need to have some type of goal. It's not just to go on them because I'm overweight or I have PCOS or whatever it is. We have to have goals in mind. Number 2, screening for things like dietary habits. Like, we got to make sure that we don't have bad dietary habits to begin with. For emotional triggers, because we know that psychology plays a huge role in bad decisions that we have. Disordered eating. So if somebody's already got anorexia or bulimia, it's just not going to be good when you combine those with those drugs. And any medical conditions somebody may have, like thyroid problems, prediabetes, diabetes, liver, like NASH or MAFLD, MASLD, any of those. Number 3, an exam, physical exam, that means in person with strength, determining strength factors on body composition and on the certain functional capacities, like can you get up from a chair, can you do simple stuff like that. So those require an exam. I mean, potentially that could be done by telemed, but 4th, determine for somebody going on these the social determinants of health. These are SDOH. They are things that are like socioeconomic or do you have a job? Are you homeless? Are you low income? Do you live in a low income neighborhood? These things have huge impact on all things health, and so it's going to have an impact on somebody's experience with these drugs. And the number 5 recommendation was a lifestyle assessment. So what is the patient that's like, if you're going on them, what does your lifestyle look like, as far as what does your aerobic training currently look like? What does your strength training currently look like? Because they need to be there even before you go on, let alone after. Sleep. What are your sleep patterns like? Because those need to be fixed. And is there any substance use, alcohol, even though we're finding that maybe this may have some role in people with substance use disorders. Social contacts, like what kind of support system do you have? And we're not talking about just TikTok, we're talking about friends and family that are going to be supportive along this journey. And stress levels, like that's not easy to change, but it can play a role in outcomes. So that's, if somebody's going to go on this is what these 4 societies say need to be covered before somebody goes on there. And feel free to comment or just in your head think about were any of these covered, or any one part of any of these 5 things actually covered, or was it just, hey, what's your BMI and your body weight? Here's your prescription and good luck. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.